Let global leaders, and that is a behavior change, a leadership change, be ready to focus on the situation at country level. Make sure that the government is responsible, that policy change takes place at country level, but that action and implementation and measurement and change is owned by people themselves. And that is the systems change we need to see. And I would like to invite every woman, every child to develop an accountability system with indicators on two issues: on how a country is making progress, and secondly, on how the different partners in the partnership are contributing to this in order to develop a system of naming and faming, sharing the flowers and the honor, and if need be, of naming and shaming. Because those global initiatives that come with a big bunch of money and that like to impose their solution on a country, they should also be held to account, but then encouraged to improve behavior.
Wow, that's a very good challenge to every woman, every child. And when you talk about change being owned by the people themselves, we cannot have people in the grassroots, people in different countries owning this change if they have not been included in the decision-making table, if they have not been included in the processes that are generating this change, right? So, Dr. Smita, I will come to you with this question because you have been working with women and adolescents directly to understand and address the unique pressures they are facing in Rajasthan during this time. And I just want you to let us know how COVID has exacerbated their circumstances. And in essence, what must we do differently to address the social fractures and inequities both during this time of the crisis and well into the future?
Hello?
Yes, Dr. Smita, I can hear you.
Namaste, how are you?
Namaste, thank you very much.
It is a pleasure to be with such great speakers on this very important topic. And thank you, White Ribbon Alliance and PMNCH for providing this opportunity. Today, we are all aware that the world is making efforts to address the challenges of COVID-19. And all the governments, civil society organizations, development agencies are making a lot of efforts to address the same. And today I will be sharing some of the insights into what women have said when we went to them. Just going into a brief history, back in 2016, White Ribbon Alliance India started a campaign called Hamara Swasth Hamari Awaaz, in which we asked almost 3,500,000 women on what is their one ask for quality maternal health services. And these asks were shared with the government, the highest level of decision making of India. And in continuation with that, we in June 2020, it was just the beginning of the unlocking phase in India. We talked to more than 12,000 women, young women, from 5 states of India. Perhaps what women have said may have changed because after the unlocking phase, the government of India has made substantial efforts to address issues due to COVID challenges. But I would really like to share what women have said and some glimpses into what came out when we discussed with women. Overall, it appears that COVID-19 has meant more drudgery, stress, and deepening of gender divide. It is an overall impression that women gave with us. For example, when we talked to women, they said that when families came back, there were more family members in small houses. And given the social structure, women had to live in very compressed situation. When families came back, for 70% of women, loss of livelihood was a major jolt. For them, loss of livelihood meant no money, and no money meant no money to buy food and other supplies for the family. And automatically, when there is not enough in the family, women bear the brunt. So almost half of them said that there was not enough food for the family, and obviously, women went hungry. Similarly, more hygiene, more sanitation meant more water in houses. And automatically, the responsibility of fetching water from a distant source fell on women. So that drudgery increased. A lot of women shared that they had to go out to buy vegetables, to buy grains for their daily needs, despite the fear and risk of going out. More than half of women said that the incidents of violence on women were more than usual. We did not go into defining and deeper into the issue of violence because it was a very sensitive issue, but women did share this. When it comes to accessing health services, women shared, almost half of women shared that we were scared. We were scared that this facility may be closed. We were scared that we might get the infection in the facility. For some, there was no transport available. There are also some good things, and I must acknowledge that during this period, the government of India made substantial efforts to inform people. And when we talked to women, and it was a surprise for us because rural women said that 70% of women said that their main source of COVID-19 information was TV. And government of India had really made substantial efforts to inform through public medias, TV, and all channels. So it was a very good initiative, and I think this should be promoted. Frontline workers also went to homes and informed women, and they appreciate that because not all women had access to TV all the time. So this was a very good initiative. Women also said, almost 50% of women said that they received government support during this critical period. And that support was in terms of food grains and in terms of money. And they really appreciated that effort. 1 in every 5 women said that they also received support from civil society organizations. So overall, it appears that given the social structure, women have to bear the brunt of anything that happens in this world. And what White Ribbon Alliance is making effort is listening to what women are saying and informing the world that these are what women are saying, these are what women want, and there is a need to change systems. There is a need to substantially change systems, and when today we are talking about data and evidence and community monitoring, I think the first change we need to make is listen to women and look at when we are designing policies, programs, and actions. Look at these actions from women's lens and include women's voices in the evidence-based decision making. Usually, we tend to listen to more scientific, rigorous evidence, which is good. But then women have their own way and their own need. So I think that needs to change, and women's voices must form the evidence-based decision making. The second and most important change that we need to make is challenge and change gender stereotypes. In all our communication, in all our action, I think gender stereotypes must not be repeated or perpetuated. And today, the most important need is inclusiveness and male responsibility to become partners in this whole challenge. The third and most important change we need to make is no tolerance. No tolerance for violence against women, for disrespect, for discrimination, for denial to all women, all the time, and at all places. I think this is very critical and we need to change this. The fourth most important change is the need for a multi-pronged strategy. The government of India has really made efforts to use all strategies to reach out to people. And given the social structure, women are usually left behind. So to include them in this package, there is a need for a multi-pronged strategy which uses all sorts of platforms, even one-to-one messaging by frontline workers in local languages, and information which is gender sensitive is also required. Women also said that they want information, complete information about their entitlements so that they can avail them. So there is a major need to look at the communication strategies that we have and really look at who needs the most. The next important thing is role of civil society organizations. The civil society organizations are there to support the government. Governments cannot be replaced, and civil society organizations cannot reach the vast uh, area that government can reach. But they need to be supported, included, so that they can support the government to address what women want. Last but not least, access to health and nutrition services with dignity is very important. Services are essential, and from what women have said, they need services, the complete package of services, which are affordable, which are accountable to women, and which are nearer to their homes. And COVID-19 has taught us that there is a need to strengthen public health systems. We need to focus and strengthen these systems, and primary health care is the basis.
Wow, thank you very much, Dr. Spina. And I think I'll just have to cut it short a bit there because you've said some really, really interesting and powerful points that I can't just let go. And for me, the most important, or what I've really gotten out from what you say, is, listening to what women want and making the change in accordance to what their needs are. And I know we can talk about women and what they want and their needs and all that all day long, because when we start talking about no tolerance to violence and discrimination and all that, then these are conversations that can just go on and on. But we do not have the time, and I will just ask every one of us to continue these conversations on chat and also on social media. And people are talking about so many things, like there's people want issues around domestic violence and discrimination addressed. And I just encourage you to keep the chats happening, and
Mercy, can I jump in here 1 second? Because I really love all the solutions that Dr. Smita has put at the table. They're all very true. But let me share one more thing.
Sure, go ahead.
Female champions who are encouraging girls and boys to respect each other as equals, so that they are able to encourage and raise a generation of girls, adolescents, and women who do not shy away once the men walk in, who are not modest, but who are acting with self-esteem and self-confidence and are respected for this. Without this addition, I'm afraid we can continue to make this advocacy forever, but this should also be brought to the table.
Thank you very much. And basically, those are the things we are talking about today. And thank you very much for raising that point. And on that note, allow me to end this panel here, because like you see, guys, there's so many things to talk about. So thank you very much, ladies and gentlemen. That marks the end of our first session for this discussion. So Dr. Saber, Shannon, Ms. Geda, and
Namaste.
Thank you very much for your time and absolutely valuable lessons on data that you have given us, and on progress for women's, children, and adolescent health. And we will go straight into the second half of this discussion, because we need to look at, we've looked at the 10 years that have passed. Now we need to look at the decade of action, and that's the decade ahead. We need to look at solutions, investments, and accountability that we need to get us back on track to achieving the Sustainable Development Goals. And now allow me to welcome on the virtual stage our esteemed panelists for the second part of the discussion, Ms. Ana Claudia Carleto, Secretary for Human Rights and Citizenship of the Municipality of Sao Paulo, Brazil. Thank you so much for joining us. And then we have Ms. Beth Schlachter, Executive Director of Family Planning 2020. Thank you so much. Dr. Monique Leder, Head of Secretariat and Practice Manager, Global Financing Facility. You are very welcome. Ms. Toyin Chukumozie, Education as a Vaccine and member of the PMNCH Adolescents and Youth Constituency. And lastly, Ms. Joy Fumafe, co-chair of the Independent Accountability Panel for AWEC. Thank you so much, ladies, for creating time to be with us today. And we are going to look at the decade ahead and, the solutions that we need, the investments we need to make. And keyword, accountability. So without wasting any minute, and as always, please, our audiences, keep your comments, your experiences coming in. And I will go straight to Ms. Ana Claudia. Our resources are finite. Like, the science is definitely in properly managing and balancing them. Yes, we are in a pandemic that requires lots of resources to manage. But how do we ensure that there is proper balancing of resources and priorities so that not all human and capital resources are geared towards COVID-19 efforts at the expense of other essential services, like, and especially provisions for women and children? And you can give us, your experience from the municipality of Sao Paulo. How are you doing it? How are you, managing those resources to ensure there's that balance? Sorry, we cannot hear you, Ms. Ana Claudia. So I think you are on mute. No, I think you are still on mute. As you sort that out, maybe we can move to Beth. Beth, are you ready?
I'm ready, thank you.
Oh, great. So, Ana Claudia, I'll come back to you in a minute. Maybe we can just sort out your audio. And, Beth, I asked Ana Claudia, the issue of managing resources, and I'm coming to you because, Every Woman, Every Child report shows that, there are billions of resources in US dollars that have been mobilized in financial commitments. We're talking about about 44 billion USDs, in terms of financial commitment. And they were talking about an addition of about 97 billion USD pledged by India. And this is just essentially to advance the health and well-being of women, children, and adolescents. What has the impact of these investments been on the health and well-being of this group over the past decade? And how do we ensure that we protect, the investments that have been made, especially during this COVID-19 period, seeing just how disruptive it is on the progress that we are making?
Thank you so much for that question, and it's an honor to be a part of this panel where I know everybody here will have really important perspectives on these issues with regard to financing and accountability. I really want to thank, as well as the previous panel did, Every Woman, Every Child, the Secretariat, PMNCH, and White Ribbon Alliance. It's a great session here to be a part of, and really critical issues that we have before us. And as you mentioned, the $44 billion that have been mobilized represent the cumulative effort of almost 350 commitment makers spanning across sectors and issue areas. At FP 2020, we've been specifically focused on mobilizing support and commitments to advancing family planning, which we know is foundational for enabling women and girls to live fuller and healthier lives, and conferring them those benefits not only on their children and their families, but for entire communities. As of last year at this time, there were 314 million women and girls using modern contraception across the 69 lowest income countries alone. Our partnership has enabled an additional 53 million women and girls to use contraception since 2012. And so the impact of this contraceptive use is real and profound. In the last year alone, it's meant 119 million unintended pregnancies were prevented. 21 million unsafe abortions were averted, and 134,000 maternal deaths 134,000 women and girls lived through childbirth because of contraceptive use. That's the power of working together and why we need to continue to stand strong and stand together as COVID-19 threatens to reverse this progress. Because we know that the pandemic has intensified pre-existing challenges and created new ones with long-lasting detrimental consequences, especially for women and girls. We know from WHO Pulse surveys that of all health services, family planning has experienced one of the most profound and severe disruptions, with nearly 70% of countries reporting some disruption and almost 10% reporting severe or total disruption. These are essential, life-saving services that are not being provided, and we must address this now or risk losing all of the progress the global community has worked so hard to achieve. However, even before COVID-19, as you mentioned, investments in health, the services and systems were under-resourced for everybody by almost $200 billion. And of course, it's precisely the populations we're here to talk about today, women, girls, and children, that all bear the ultimate cost of the lack of resources. For family planning specifically, meeting all needs for contraceptive care in low and middle income countries would cost $12.6 million annually. That's $5.5 billion more than is currently being spent or was spent before COVID. So if we're to refocus, if we're to recover, as this report says, we must reinvest as well in our health systems, in our accountability to each other, and in our partnership. FP 2020 is turning to that now, and I know that Every Woman, Every Child and PMNCH are as well, as we reimagine and recommit our own partnerships. And we all believe that women and girls deserve nothing less. So thank you.
Well, thank you very much. And, on that note, let me just come to Joy. Dr. Haida talks about, these millions of dollars that, have been input into women, children, and adolescent health. And, even when you talk about COVID-19 and managing, how we are responding to the needs of this group, we are still seeing reports of embezzlement of funds and, sorry to say, people in government just going haywire with money that is supposed to be channeled towards COVID-19 and women, children, and adolescents. The 2020 report of the Independent Accountability Panel raised an alarm on these and warned that an estimated 20 to 40% of health expenditure is wasted globally due to inefficiencies and corruption. How does this affect our fight for proper health and well-being of women, children, and adolescents? And as countries or organizations, we need to ensure full accountability, which connects commitment to progress, right? How do we do this with all that's happening?
Thank you so much. And I would like to thank PMNCH. I would like to thank Every Woman, Every Child, Right to Born Alliance, and members of the panel. Indeed, corruption is taken root in the health sector globally, whether it be in domestic public sectors through local official bribery, embezzlement, whether it is the private sector with their business, invasive, with investment as that benefit is driven by the type of corruption that is perpetrated by this led to politically motivated investments. Strongly advocating for is the urgent institutionalization of accountability. How do you accountability is a must-have for good governance? It is not a nice to have. It must be permanently embedded so that leaders, managers, implementers, partners, and all stakeholders are committed to the people they serve and seek to support through an open, transparent, timely, and regular sharing of information on their roles. People must know, what is the role of my politician? What is the role of my district health manager? What is the role of my nurse? And what resources do they have to give me the services that they are supposed to give me? And what are these services that they must give me? And they must justify, that is, these leaders, these managerial actions, openly and transparently. Explain them. They must be based on evidence. I think COVID-19 is teaching us that very, very effectively. They must be based on the rights of communities, of women, children, and adolescents, and the rule of law. And it is for this reason that we are saying civil registration of all deaths is critical. Unregistered people are invisible. They will not be planned for and they will not be covered. Causes of mortality that are not recorded will also be unplanned and they will not be addressed. And what we are saying is that they must implement institutional, open, transparent core accountability functions, monitor, review, remedy, action with the participation of communities. Open monitoring, open that an impact so that people knows what is progress towards the goals and targets. What we are saying, accountability must be democratized. So the content and the quality conditions are taken into consideration. Countries like Ghana, countries like Ethiopia. And what we are saying is that let us take lessons from these best practices.
Sorry, allow me to interrupt you, Joy, because we're getting a lot of disruptions from your end. I think your internet is not stable and it's become pretty difficult to get what you are saying comprehensively. So please allow me to interrupt you a bit as you try to maybe sort that out and move back to Ms. Ana Claudia Caleto. Are you back on? Say something. Hi.
Hi.
Great.
Can you hear me?
Yes, I can hear you now. Sorry about those audio issues. And yeah, we can now hear you clearly all the way from Nairobi, and I bet everybody from the 109 countries are hearing you nicely now. And I just posed to you a question about, our resources and they being infinite and, just how to manage and balance these resources to ensure that we do not, cut what should be directed towards, responses on women, children, and adolescent issues and their health and well-being in favor of, working on other issues relating to COVID-19. As much as we appreciate this is a global pandemic, there must be a lot of resources that must be channeled towards that. But how do we get that balance to ensure that we do not do this at the expense of women, children, and adolescents?
First of all, good morning at all. I'm glad to be here. And on behalf of Mayor Bruno Covas, I would like to salute all the organizers of this panel. So, Mayor Bruno Covas has been publicly advocating for the rights of vulnerable people, especially during this pandemic, take care of them and listening to their demands as a center of goals of his mandate. In terms of essential health, São Paulo built 3 field hospitals in order to guarantee that everyone will have access to public health, relieving the public hospital network. Thanks for this decision, the city never had to decide who would live and who would die. During the COVID-19 pandemic, the mayor also created a program called Solidarity City. Since May, we have bought more than 1.5 million food and sanitary kits to vulnerable people in São Paulo, distributing these items in partnership with the Red Cross and NGOs, working directly with women, indigenous people, migrants, the elderly, etc. Of course, there are specific actions taken by each office during the COVID-19. In the case of the Secretariat of Human Rights and Citizenship, for instance, we have already distributed over 1.1 million packed lunches to homeless people in the city, including for almost 4,000 homeless women and children in São Paulo. When we work in front line, we need fast response for humanitarian needs. We must rethink and rebalance all our resources and priorities. That is inevitable. People in the city need short-term assistance in moments of crisis like this. However, we also need to balance this reality coupling with long-term measures to foster the autonomy of vulnerable people and social minorities. In this regard, the Secretariat of Human Rights and Citizenship kept open all its equipment and service during the pandemic, with special attention to families with vulnerable children and women. As I said before, specific actions are taken by each office during the pandemic, especially to avoid overlapping public expenses in time like this, where we need to spend wisely and plan ahead of the time. Innovation and creativity, in this sense, are special features of our municipality to ensure healthy lives and promote well-being for all and at all ages, and also to ensure inclusive and quality education to promote lifelong learning opportunities for all, making cities inclusive, safe, resilient, and sustainable for all the next generations.
Wow, thank you so much, and Claudia, for those comments. And you are talking from your experiences and what is happening in Sao Paulo municipality. And we have somebody from the Global Financing Facility here, Dr. Monique Leder. And even as we reflect on what Ana Claudia had said, let me just ask you, she's talking about, what they have prioritized as a municipality in the country. And I think of your role at GFF as an entity that is supposed to help governments to transform how they prioritize and finance the health and nutrition of the people. And I think that role is really key, especially now. And when we think of focusing on care during pregnancy, birth, and early years, adolescence, and primarily just general care for women. So could you just explain how GFF is supporting countries right now in their own response to decisively save lives and protect the delivery of essential services as part of trying to navigate this pandemic, get out of this pandemic and even thrive after the pandemic is done?
Great. Thank you so much, Mercy. It's really an honor to be here this morning. I'd like to also thank the organizers, and it's so wonderful to see so many colleagues and old friends. It's a shame we can't meet in person, but it's really great we can have this conversation. And so for the Global Financing Facility, we have since COVID started, worked with the 36 countries that are currently part of the GFF program to look at, with the Ministries of Health, to look at the essential services and are the services reaching women and children. And last week we released a press release with the analysis of the first 10 countries, 63,000 health facilities, really showing, even though there's quite a variation between the different services and between countries, we're showing quite a severe impact on the disruption of essential services for women and children. And just to give you an idea, for example, in Nigeria, we saw a 16% decline in antenatal care. We see across the board a significant decline, sometimes up to 30% of outpatient visits, as well as child vaccinations. And so, taking that into account, when we started seeing that in February and March, we immediately set up a virtual programmatic policy platform for all of our countries to participate, look at this data, and based on their local context and country needs, to design and finance programs that can address these challenges, to really ensure that we can continue those essential services on country level. And it's really great to see how around the GFF the partnership comes together. And we saw a tremendous engagement of civil society from very early on in the COVID response, to really ensure that there was sufficient advocacy around the issues for women and children. We're also looking at the issue of supply chain. And so there's been quite a lot of disruptions in availability of important commodities that will allow quality of care for women and children. And so we're looking into the local production of protective clothing for health workers, so that they can continue staying on the job, as well as for certain commodities, particularly for Africa, so that they become less dependent on global supply chains for those important commodities. And maybe just to close off, because I know you want to keep time for discussion, which is always the best part. We are launching the new strategy. We're at 5 years of implementation, and the doubling down, the COVID crisis has more than ever shown the importance of a functioning health system. And so we're doubling down on the essential services and the system strengthening agenda in collaboration with partners. But I also just want to build on what Joy was saying around the accountability, the importance of the voice of women in shaping health services. And that also includes a really big emphasis we want to put on female leadership. When women are in decision-making positions, it's very well documented that they make decisions that really take into account the needs of women and children. And we want to further strengthen that and ensure that we have not only as health workers, nurses, women contributing to healthcare, but that also in the decision-making, including on financing, women can take the lead on ensuring that we have a better future for all women and children and adolescents. Thank you.
Thank you very much, Dr. Monique. Now, and I'll come now to you, Toyin. All the speakers that have spoken before you are talking about financing, you're talking about resources and good technology. And, with all these then comes so many innovative solutions to, addressing gaps of women, children, and adolescents. But, when we talk about technology and innovative solutions, we also have to talk about broadband and social media, and how to use this from service delivery to self-care and information sharing. But this is not really the reality for many people who are maybe, living in places where there's no internet and all that, and there's this digital divide. How do we ensure that no one is left behind, even as we focus on financing and technology and building resources, and as a way of rebuilding our system after COVID-19 and in preparation for future pandemics? How do we ensure that no one is left behind and that digital divide or that digital gap is really minimized, if not eliminated?
Okay, thank you so much, Mercy, for your question, and thank you very much to PMNCH for the opportunity to be a part of this conversation. I'll start by saying that the solutions that we have to provide, they have to be multi-component solutions, and they have to fit our context. These solutions have to take into consideration the fact that adolescents and young people are not a homogeneous group. And so they have to be tailored to their needs. And of course, we have to work in partnership with adolescents and young people to tailor the solutions and ensure that it suits their needs. Having said that, digital solutions, yes, they do have a great potential to reach adolescents at scale, wherever they are. And I'll share our experience at Education as a Vaccine, a youth-focused organization in Nigeria. We've been using digital platforms to provide sexual and reproductive health information to adolescents and young people since 2005. We started with learning about living. This was an electronic curriculum that provided life skill information, sexual and reproductive health information, and it was web-based. And so young people would have to go to cyber cafes. At the time, this was the easiest way to get access to the internet as a random person. Of course, this has its own challenges. And so with feedback from young people showing these challenges and stating these challenges, we then evolved to providing hotlines services, and then also expanded to a service we call the My Question and Answer service. So this is like an SMS-based service, so a short message service just sending text messages to a short code, and the platform was created for young people to ask questions and get accurate answers from a trained counselor on the sexual and reproductive health, even their relationship concerns, and it was for free. So from any mobile phone, they can send a text message to that short code, and the service is anonymous, is confidential, and it's a non-judgmental service. We've reached over 1 million young people in Nigeria since inception, and we've worked with young people over time who themselves are telling us what works for them. And so in this way, we sort of are creating like an ecosystem of solutions that can be integrated into any program or any intervention to meet the needs of young people. We've reached a diverse group of adolescents and young people, including young people living with disabilities, young people living with HIV, in school and out of school young people from diverse sexual orientations, young people who are in internally displaced camps. I want to emphasize that these services have to be toll-free, as this is key to increasing access and improving access. There's also a need to continuously assess and update digital solutions to ensure that we are reaching the most vulnerable and the hard-to-reach adolescents. With all the disruptions that COVID-19 has brought to health and to education for adolescents and young people, it is clear to us that there needs to be a move beyond face-to-face interactions in providing the support that young people need to improve their well-being. So we really need to explore and take advantage of the possibilities that digital solutions can offer in providing life-saving information, including comprehensive sexuality education for adolescents and young people. And there are many ways that we can do this. We can provide toll-free hotlines. We can provide free text messaging services. WhatsApp can be a platform to be leveraged. We can provide animated videos that have the content that we want to pass across in the local languages. We can also, of course, leverage social media, and of course, for young people who are in urban and settings, mobile apps as well can work. But traditional media, such as radio, is still very valuable for adolescents who are in hard-to-reach areas. In a country like Nigeria that is really vast, there are adolescents in, areas that are geographically almost inaccessible. And you see that radio is still one way to reach them with information. But it is important for me to also mention that young people would access services in an environment or through a medium that they can trust. And so it's important to protect their privacy. It's important to maintain confidentiality to enable them to engage effectively. Lastly, I would add that it's also very important to strengthen advocacy around delivering different solutions, including digital solutions for adolescents and young people, because these solutions can only work when we are contributing to an environment where the laws and policies make it possible for the solutions to reach those who need them. Thank you.
Thank you very much, Korean. We could go on and on about the decade ahead, and because there's so much to discuss. And I know we were looking forward to a little bit of a chit chat back and forth between us, but because of time, unfortunately, I have to end it here. So thank you very much, Anna Claudia, Babe, Dr. Blada, Toyin, and Joy for the wonderful insights on how to ace the next decade. And my key takeaway from these deliberations are that even as we celebrate progress globally, we should be careful to note that the progress is not equal, and still there are many other regions where women, children, and adolescent health and well-being are doing so badly. And we have learned of the need to address the gaps and challenges that the global community must urgently act on to ensure that we just have more investments in sexual, reproductive, maternal, newborn, and child health. And even as we seek more investment, especially on the financial front, then the big question will be, how are we utilizing this money? Is it going to the intended recipients? Is it going to the most vulnerable? And we should not forget that data and evidence are powerful tools in advocacy and decision making. So thank you very much, our esteemed panelists, for your time and your really, really valuable information. We really appreciate. And on that note, I will transition to the next session, and we are calling this Brave Voices, Bold Actions, delivering on what women, adolescents, and children want during COVID-19 and beyond. Now, from Uganda to Mexico, Nigeria to Brazil, the US, and DRC, all over the world, there is one deep desire, genuine desire from women, and that is to be heard. The What Women Want campaign has been described as the largest ever open-ended survey into women's opinion on their own needs for quality and reproductive and maternal health care. It is the authentic, brave voices of 1.2 million women of all ages from all walks of life from more than 100 countries. Now, these women were asked about their top priority for quality maternal and reproductive health care services, and they gave a list of demands. And these are demands that they want political commitment, investment, and accountability on. This next session is what I think of as citizens' parliament. Basically, we are giving the voice to the people, but not only the people. This is also a moment of discussion on both leadership and citizenship, and we are seeing these people come together and just reflect on all these words. And speaking of citizens' voice, let's first begin by hearing from women and young people themselves in this video from What Women Want campaign convened by White Ribbon Alliance.
I have a right to quality services.
اوس زه دا غواړم چې زما د خپل علاقې خپلې زنانه د خپلو ماشومانو او د خپل ځان د صحت خیال وساتي او د خپلو ماشومانو د خپلو حقوقو نه خبر وي.
Kazalira aha omu kibira omu mwirima ubwo omushaija wanje yabira nyine ntuze omu igwariro eryabire riri 30 kilometers kuruga omuka.
zovuta zimena kumana zikuniko mabedi amene ali uchepa pamalopo oti mukazaza anthu amatha kumala kilomita zimatisi pasi mungugo.
Ubwo ndikuteekateeka ngu ekyanyima nikiija kwija kugumamu kindetera okujwa mpika kufa kwonka omwana wanje akaba ahuriire.
زموږ دا حق دی چې موږ ته د دلته هسپتال کې بهتر سهولیات موجود وي، د هسپتال انتظام دی صحیح وي او د هسپتال کې د صفایي خیال ضروري دی.
kuno kuli mavuro raonanirele kwabonda nyasizo kazoka vimadzivo kavoka tele rufuna kuri mkuno wako kusinthe
ezimene lione kuno kubodza nzovura zedi mulindapire kuchimbudzi vose vidadzala kumasikira sefunto zosho
kuna chiremba nitazofundira svikaoko kwano kubato zvakanaka taura nemune zvakanaka tichitora tichinzwisisana kana kanganisa achindiratidzawo mune zvakanaka.
Ladies and gentlemen, now more than ever, it is time to listen and act on these demands. Already, this pandemic is disrupting so much. The provision of life-saving maternal services and adolescent health services. It is eroding sexual and reproductive health and rights of women and adolescents. And we're just seeing an exacerbation of systematic and structural racial, ethnic, and gender inequities everywhere. In July, we had the Lives and the Balance virtual summit on COVID-19 and women, children, and adolescent health. And there we launched the PMNCH call to action on COVID-19. And there were 7 asks to governments for greater action on, and, asking for investment, policy, and service delivery. And, you can see these asks in depth on the PMNCH website. So in this next forum, we bring forth dialogues between women and decision makers based on 4 main asks. We are going to look at respectful and dignified care, clean health facilities, toilets and water, what we, refer to as WASH. And then we're going to look at essential sexual and reproductive health, medicines and supplies, and finally at more and better trained nurses and midwives, because essentially that is very important, especially during this time. And before we get into that conversation, again, I just want to ask our audiences, please do keep the conversations going in chat. And this time, I want you to let me know your name, your country, and tell us that one demand or issue for more action on COVID-19, and what you're just asking the various decision makers, whether they are on the panel or those who are watching this or those who will watch this, because this will be online for quite a long time, what you want more action on COVID-19. So put that demand or that issue you want to address, you want more action on the chat box. And my colleague Jane is keeping an eye on your responses. And maybe we can look at some of those responses after the first panel and at the end of the session, Jane. So for now, let's get the conversations going on our virtual stage. In our first panel, we'll be discussing issues around respectful and dignified care and water sanitation and hygiene, like I mentioned. So joining me on screen is Honorable Dr. Vardhan, Union Minister for Health and Family Welfare, India. Thank you so much. Really good to see you with your mask on. And then we have Ms. Paulina Nyona from the Organization of African Youth Kenya and PMNCHA NYC member. And lastly, we have Honorable Professor Margaret Kobia, Cabinet Secretary, Ministry of Public Services and Gender in Kenya. Welcome. In Swahili, we say Karibu Sana, Dr. Vardhan. It's really, really good to see you. But as you just get comfortable in all this, first, let us watch this video testimonial done by Reena Yadav, member of Legislative Council, Bihar in India.
नमस्कार, मैं रीना देवी उर्फ रीना यादव नालंदा से बिहार विधान परिषद की सदस्य के रूप में आपके सामने उपस्थित हूँ। साथ ही साथ सत्तारूढ़ दल में सचेतक की भूमिका का भी निर्वहन कर रही हैं। मेरा मानना भी है और मैं ये समझती भी हूँ और पूरी तरह से इसको मैं मजबूती के साथ सदन में भी रखने का काम करती हूँ कि हमारे स्वास्थ्य सेवा को गरिमापूर्ण और गुणवत्तापूर्ण और बिना भेदभाव के स्वास्थ्य सेवाएं समुदाय के हर व्यक्ति को मिलनी चाहिए और खास करके जो हमारी महिलाएं हैं उन तक ये विशेष करके ये स्वास्थ्य सेवा का लाभ उन तक पहुंचना चाहिए। 14 दिन का जो क्वारंटाइन करने का जो पीरियड था उसमें जो हमारे जनप्रतिनिधि थे, चाहे वो मुखिया के रूप में महिला जनप्रतिनिधि थे या वार्ड सदस्य के रूप में थे, उन्होंने बहुत ही महत्वपूर्ण भूमिका निभाई। इसके साथ ही साथ मैं आपको बताना चाहती हूँ कि हमारी आंगनबाड़ी की जो सेविका थी उन्होंने भी अपनी जिंदगी की परवाह न करते हुए, अपने परिवार की जिंदगी की परवाह न करते हुए फिर भी वो घर घर जाकर के उन सूचनाओं को प्राप्त करने में सक्षम रही। जनता के सामने अगर कोई समस्या आ जाए, किसी तरह से खून की कमी की परेशानी या डॉक्टर का ऑपरेशन करने से इनकार कर देना या फिर महिलाओं को धिक्कार देना या गरीब है तो उसको किसी और जगह भेजने का प्रयास करना, तो ये छोटी मोटी जो जटिलताएं जो समस्याएं हैं वो हमेशा यदा कदा हमारे सामने भी आती रहती हैं। तो इसके लिए हमने अपने जनप्रतिनिधि को वहाँ पे रखा है हमारे सदर अस्पताल में, जहाँ पे वो हमेशा रहते हैं और एक फ़ोन कॉल के जरिए हम लोग उनसे बात करके उनके साथ उनको भेजने का काम करते हैं। और अगर आवश्यकता होती है तो हम लोग डॉक्टर से भी बात करते हैं। अगर आवश्यकता होती है तो इस तरह के समस्याओं से जूझने में जब ज़रूरत पड़ती है तो हम लोग विधान परिषद में उन समस्याओं को भी रखने का काम करते हैं। जैसे कन्या उत्थान योजना, जिसमें किस तरह से भ्रूण हत्या को रोका जाए। हमारे यहाँ जो छात्रवृत्ति के रूप में, पोशाक राशि के रूप में, साइकिल योजना के रूप में और नैपकिन योजना के रूप में बहुत सारी योजनाएं हमारे स्कूल में, हमारे सरकारी स्कूल में लड़कियों के लिए दिए जा रहे हैं। तो मैं समझती हूँ कि जब शिक्षित महिला, कोई भी शिक्षित महिला जब अपने अधिकारों के लिए जब बाहर जाती है तो उसे कोई भी व्यक्ति जो है धिक्कार नहीं सकता है और उनकी समस्या को नहीं सुनने का कार्यक्रम नहीं कर सकता है। आप सभी को हृदय से आभार प्रकट करना चाहती हूँ कि आपने एक विशेष मुद्दे को लेकर के मुझे इस कार्यक्रम में बुलाने का कार्य किया और मुझे एक मौका दिया कि मैं अपनी बातों को रख सकूं।
Dr. Harsh, I will come straight to you. You have seen Rena's video, and she raises some points on quality, respectful, and dignified care. Now, India remains one of the most high-risk places in the world to give birth, and almost all the deaths that occur are preventable. But even as we know that fact, we know that there have been processes and all these measures put in place to try and continue decreasing India's maternal mortality rate. What are you doing to make this a realization? What are you continuing to do to ensure that this fact is eliminated and basically we see a continual decrease in maternal mortality rate in India, especially when it comes to that aspect of realizing women's right for quality and respectful healthcare?
Thank you, Mercy, for that vitally important question. And I must admit that I and my government have been trying to address this issue on priority. This sentiment was echoed by Ms. Reena Yadav, whom you all heard, and it is so very heartening to see that local leaders and their voices are getting global platforms and recognition to showcase the tremendous lift that local administrations have made in the past few months, despite the pandemic. Regards your question, we reckon that maternal and maternity care goes much beyond only healthcare services for the mothers, but sets into motion an experience for lifetime. It's the lived reality of a woman who depends on a responsive system to cater to her needs of not only services, but also dignity, privacy, confidentiality, choice, and respect for her as well as her baby. It is not just about a provider or a client. It's about human dignity. That was the reason that our government has been working in an incremental manner to provide respectful maternity care. From instilling a behavior change to help more women deliver in hospitals, to entitlements for absolutely free services, we have come a long way now in providing quality care throughout the pregnancy and childbirth with interventions like Lakshya and midwifery care. Last year, I started a Safe Motherhood Assurance Suman initiative that brings all these services under one umbrella. We are now following a zero tolerance approach for service denial to pregnant women and their newborn babies, and have also strengthened our system for client feedback, grievance redressal, and greater accountability and transparency. The idea is to have a fully responsive and accountable health system that will not only result in a positive birthing experience but also help end preventable maternal and newborn deaths.
Wow, thank you, Dr. Vardhan. And you talk about human dignity and having a responsive health system to take care of maternal health and to end the preventable deaths that we are witnessing. Now, I will come back to you shortly, but before then, let me tell you, ladies and gentlemen, a little story that really saddens my heart. 2 weeks ago, there's a video clip that went viral on social media in Kenya. And this video was played on news, in major television stations. It shows a man emerging from a car at the gates of Kenya's largest maternity hospital, and this is Pumwani Hospital. This man was carrying his pregnant wife who was in labor. She was crying and in need of immediate attention. But they were denied entry into the hospital and told that the medical workers were on strike. The woman was overwhelmed with labor pains. She could not make it to another public hospital and she could not afford to go to a private facility. Now, ladies and gentlemen, right outside the hospital, which sits in front of a really busy highway with hundreds of cars and people passing by, this woman lay down, wailing, desperately calling for help, and a few minutes later, she gave birth on the tarmac road, right outside the hospital gate. Zero privacy, tens of onlookers, some filming her ordeal on video. That video is still trending, and the internet never forgets. The video will still be up for years and decades. Just picture the disrespect and the indignity. Professor Margaret Kobia, this happened in your country, my country, Kenya. Is there anything that justifies a mother delivering on tarmac at the gate of a facility that should be taking care of her?
Thank you. Thank you very much, Imase. My name is Margaret Kobi. I come from Kenya, Nairobi. And I just want to respond to that unfortunate incident where our mother actually delivered around the gate. That is an example of what should it happen if all the systems were working well, but the incident happens, and I think we should take it as a lesson. That's not what we want to see happening to the women anywhere in this country. Therefore, I would say in my case, one of the demand that is facing our country and from where I sit is the demand for inclusion so that women have an opportunity to participate in decision making on matters that concern their own lives. Therefore, that was quite unfortunate, and what that teaches us, Mercy, is that you can have very wonderful policies, strategies, which is saying what should happen. In Kenya, we have universal health coverage, and we have the Linda Mama program, which have worked very well. But one incident like this, which happened when the Pumwani Hospital was on strike, cannot be excused. But that it tells you just having policies and systems and strategies in place, you need more than that to ensure that the systems actually work and serve the women and the children according to their needs.
Well, thank you for your response, Dr. Kobi. Now I'll go back to Dr. Vardhan, and maybe all of you can just, keep reflecting what I've said in mind, and that should form the basis of, the discussions we're having today. And when we talk about respect and dignified care, those are some of the things we just don't want to hear of or see. And Professor Kobia talks about responsive policies and ensuring women sit in decision-making tables and all that. Dr. Harsh, how can governments ensure that, the notion of safe motherhood is expanded beyond the prevention of morbidity or mortality to look at the respect for women's basic human rights and, preferences during maternity care, especially during this period? And when you talk about preference first, we're talking about the ability to help them decide which kind of birth they want to go through or how they want to deliver their children, and not being forced to choose a particular way because we maybe want to decongest our hospitals during COVID and all that. So how do we ensure that we look at that and focus on things beyond mortality and morbidity?
Mercy, I strongly believe and agree that women must be empowered to decide for themselves. And therefore, we have been trying to utilize multiple contact points through the antenatal and childbirth period to help women make informed decisions around safe motherhood practices, choice of birth companion, identifying referral transport, and postpartum contraception, to name a few. I would also like to add that right now, India is transitioning towards a phase of moderate levels of maternal mortality, and our analysis have shown that many of the maternal deaths occur due to delay in timely provision of comprehensive obstetric care. As a clinician myself, I understand that most of this morbidity and mortality could have been prevented through timely cesarean sections. We believe that with better quality of public health care facilities, regular cesarean section audits, adherence to SOPs in the labor room through structured interventions, we shall be able to progress faster. Another important step towards universalization of skilled birth care is introduction of midwifery nurse practitioners in India. We have prepared a detailed roadmap with an aim to scale out midwifery services throughout the country. To sum up, respectful maternity care is a top priority for India, and we are working with a multitude of service providers to this end.
Thank you very much, Dr. Harsh. And I'll just end it there on respectful maternity care. But please, ladies and gentlemen, keep discussing on chat, keep discussing on social media, because this is not something that ends today. Even after these 4 hours, we still need to push for the rights and health and well-being of women, of maternal, child, newborn and adolescents' health. Now, there are dozens of women who are watching you now, Dr. Harsh, from your country, India, and hundreds, thousands from all over the world. They are demanding for quality, dignified, and respectful maternal health services. Can you commit to that?
India has been a strong proponent of democratic systems, and we believe in hearing out the voices of the people and respecting their views, opinions, and demands. India is one of the countries that was instrumental in shaping this PMNCH call to action, and we reiterate our commitment to the women, children, and adolescents of India, and we will continuously direct our efforts towards improving their health and well-being. I will also urge the government counterparts and the wider PMNCH community to come forth and state and commit their support and resources towards this call to action and greater good. Let's ensure health for all and that no one is left behind.
Thank you very much, Honorable Dr. Harsh Vardhan, and thank you for your insights and your pledge. Please remain on screen, and for any of our viewers, the audience, if you have any questions for any of these panelists, please put it down on chat or just share your experiences and thoughts. And Jen will pass some of the questions to me, and we'll be able to shoot them to this amazing panel that we have. Now, let's talk about water sanitation and hygiene. And we all know that action in the wash sector is very critical for both containing the coronavirus and lowering its immediate impact and aftermath. So safe wash services, they are very essential, not only in the healthcare facilities, but in our communities. We're looking at improved hand washing behavior, food hygiene, safe water practices, and these are really essential to prevent further transmission. I will start with you, Pauline. What has your experience been in the last 6 months as a youth, especially navigating COVID-19 and accessing essential wash services?
Thank you very much, Mercy. So, over the last 6 months, first of all, I come from, my organization is called Organization of Africa Youth Kenya, and we are a youth-led organization and also a lead partner for the PMNCH Advocating for Change for Adolescents Toolkits. So my line of work is mainly with adolescents and young people. And for the last 6 months, or at the beginning of the pandemic, we conducted a survey with adolescents and young people, basically the people that we work with, on the impacts of COVID. And just to say the least, wash is more pronounced during this pandemic. And because of the control measures for the pandemic that require that you wash your hands for a minimum of 20 seconds, and that is after almost contact with everything that you come across, I assure you that young people, adolescents and young people have had quite a task. And some of them have had to travel or to walk long distances to fetch water. And then when you come back with your water, you are torn between using it for drinking, for cooking, or just putting it aside for washing your hands and disinfecting the surfaces. And more so for adolescent girls that have just had their first menses. So you can imagine if you're an adolescent girl living in Kenya in the middle of a pandemic and you don't have access to water, you don't have access to soap, you don't have access to the basic PPEs that are required, like hand sanitizers. It's been quite a task. And I think it's good to be having our decision makers on this virtual engagement platform. At least I'm sure they've had a chance to see some of these things that are happening in our country, especially regarding wash, especially during this pandemic. People living in the cities have no access to water because sometimes the cost of water is high. You find that in some places a unit of water goes for $3, and you find that the requirements of this pandemic are so, for the control of the pandemic, require a continuous supply of water and clean water for that matter. So it's been quite a task, and young people have had quite a challenge navigating through the pandemic. And in addition to that, having to weigh between using your money, your hard-earned money, which has the pandemic has been has posed a challenge to livelihood sources. So you can imagine having to choose between buying food and buying water for cleaning or for just ensuring that you are in a sanitized place so that you are able to curb the spread of this COVID-19. So young people and adolescents have had quite a task managing through the pandemic. However, as an organization, we've been able to train young women. In some parts of the country, in Kisumu County, we were able to train young women on soap making, so that in addition to
Pauline, allow me
so that
just before you go into what your organization is doing, allow me to bring Professor Margaret Kobier again back here and just ask you this question. Professor Kobier, as Pauline says, access to wash services is considered a luxury for millions of Kenyans. Now, why should I as a woman choose between drinking water, washing my hands, or even taking a bath during my periods? And As you reflect on this, is the Kenyan government contemplating on building long-term sustained solutions and behavior change when it comes to resilient WASH programs in relation to women and adolescents and girls?
Thank you. Thank you very much, Mercy. What Pauline is saying is true. In Kenya, we do experience that 50% of the Kenyans do not have access to water. And for that reason, you can imagine now when COVID set in, the demand for such a service. Therefore, what generally we understand is women want clean health facilities, including the toilets and including the bathrooms. So what has the Kenya government done in that connection? Of course, Mercy, you must understand also government takes care of everybody. The 50 million or so. And so sometimes there are not enough resources to reach everywhere. But the government also sets a minimum standard that must at least be achieved to be able to benefit from the resources that the country has. So the Kenya government vision is actually to have a clean, healthy nation free from sanitation and hygiene-related diseases. I think the Ministry of Health has already demonstrated that if we hand water, besides saving women time they go to fetch water, we would cut down also on diseases that come to the citizen. Therefore, the government has prioritized access to water to improve sanitation from 50% to something like 80%, and by the year 2030, we would want to see 100% of access to sanitation and hygiene, and especially water. In the informal sector, the government during COVID, it has already dug about 100 boreholes in Kibera, for those of you who know, and the other places like Mukuru Kwajenga. And also in our country, in the rural area, the government has dug some dams. We have also gone towards implementing what we call Kenya Environmental Sanitation Policy, and also we have Ministry of Policy, which also has strategies of how we increase access to water and sanitation in both across the country. Therefore, one is trying to work very hard, increase the budget to have access, because we must have access to water. So our unit is to what extent every year are we having more women and girls access water for their own domestic use, and of course with this increased demand now of COVID. The other area is government has also partnered with the civil societies, and I think that's where Pauline would come in, that we are struggling to answer the question, how do we train women and girls so that they can be able to access water, and even how can they go with these boreholes that have been established and go to some small businesses, how they run this water so that they can be able to use as a way of motivating. Therefore, working with the private sector, working with the communities, Nyumba Kumi in particular, Nyumba Kumi is the smallest structure, is the one which will make sure there's a water point, the water point is safe, and everybody is getting access. Therefore, the government has been working hard on these areas. Of course, sometimes the resources are not enough, and not every, but I can tell you, we have increased right now. We have about 18 million children, girls and the younger children going to school. And what the government has decided, every school must have water, must have soap, and it must also be able to sanitize if our schools are going to open. Therefore, what COVID has done has set more spotlight on the need for improved sanitation and hygiene more than before. Therefore, I see a situation where the government is also appreciating what the UNICEF and done with the WASH program, which was here in Kenya. It has worked in 11 counties, and we hope with this increased demand, we can move from 11 counties to more than maybe close to 20. So with those commitments of why haven't we fulfilled our commitment in the past, the resources have been a problem, and that's why partnership is very key. And we can count several organizations who have partnered in Kenya to improve access to water and also to be able to improve the policies moving towards improving the sanitation for women and girls. Of course,
and allow me to stop you there. because you're mentioning, partnerships and resources, and I think that's why we're here today to build those partnerships. And allow me to end this panel here, and our heartfelt gratitude to you all, Dr. Vardhan, Professor Margaret Kobe, and Pauline Anyona, for your amazing insights on respectful and dignified care, and also WASH. And now you'll allow me to move to the second panel in this session that will discuss issues around essential sexual and reproductive health services and supplies, and more and better trained midwives. So joining me on stage are Ms. Oriana Lopez Uribe, Executive Director of Balance and spokesperson for Maria Fund. Maria being the Spanish acronym for Women, Abortion, Reproduction, Information and Accompaniment. We also have Honorable Dr. Hugo Ramirez, Vice Minister of Health, Mexico. Oriana and Dr. Ramirez will discuss provision and availability of essential sexual and reproductive health rights services and supplies. And from Nigeria, allow me to welcome Dr. Abiola Afolabi, a Nigerian lawyer and civil rights activist. She is also the Executive Director of Women Advocates Research and Documentation Center. And lastly, Honorable Dr. Osagie Ehanire, Minister of Health of Nigeria. Thank you so much for joining us and for your time today. Please put your video on if you've not put your video on.
Dr. Lopez-Gatell is about to connect to the session. So thank you. Good to meet you, Mercy.
All right, that's great. That's great. Is Oriana here? Hey,
Yes.
Oriana, nice to see you. Thank you for joining us. And, as we wait for just one more person to join us, maybe I can start, with you, Oriana. And no, before I go there, please, guys, I hope you are tweeting and talking about this conversation on social media. The hashtag is #AccountabilityMatters. And yes, back to Oriana. I have read a little bit about you, your childhood in Mexico, and the work you do now. And let's take a trip down memory lane. How old were you when you were exposed to reproductive health products like condoms? Very short answer.
I think that I was maybe 8 years old or younger, because my family worked also in family planning in Mexico in a big organization called MexFam. So I grew up among contraceptives and sexuality education materials.
And that was quite a privilege, right? To have such information. And sadly, and you would agree with me that that is information that millions of girls in Mexico do not have access to today, right?
That is true. And it's a shame that still we don't have sexuality education and we don't have access to proper counseling on contraceptives, especially for adults and girls. There's social barriers to actually providing contraceptives to young adolescents. And even to women, if they decide that they want to be sterilized, and if they are 27-year-old and they already have children, the doctors often say they're too young to be sterilized, and they don't know if they will want to have more children. So it is a problem of actually empowering and listening to women and adolescents of what they want. It's actually a missed opportunity to give them all the information and all the access to the services and the contraceptives that they need.
And do you have adequate campaigns to ensure that this information gets to them? I don't know if Dr. Ramirez is here yet.
Sorry?
Is Dr. Ramirez here? Oh, great.
Dr. Lopez is still. I think it has been a missed opportunity for the past 20 years that there hasn't been enough campaigns on sexuality and on contraceptives in particular. And I think that it's still, right now for the pandemic, we all know that unwanted pregnancies is going to be one of the highest numbers because of the